Your skin. The body's biggest organ shields you from the elements. However, you can sometimes still develop skin conditions or various problems with your skin. Some common skin conditions include eczema, psoriasis, hives, and vitiligo. Welcome back to MKGI Skincare, where glow that matters. And here are the 13 common skin conditions that you should know about. 1. Ringworm. Ringworm, also known as tinea or dermatophytosis, has nothing to do with a worm. The part of its name comes from its ring-shaped rash that's red and itchy, according to the Centers for Disease Control and Prevention (CDC). Rather than a worm, though, it's caused by a contagious fungal infection that lives on skin, surfaces, or items like towels, clothes, and bedding. Symptoms, which include itchy, red, and cracked skin that's sometimes accompanied by hair loss, typically appear between 4 and 14 days after coming into contact with the fungus, according to the CDC. To diagnose ringworm, doctors may take a skin sample to view under a microscope, though they may also be able to diagnose just by looking at it, according to the Mayo Clinic. Once diagnosed, ringworm is treated with topical antifungal creams or ointments that are available over the counter or through a prescription. 2. Cold sore. A viral infection usually causes cold sores or fever blisters, which are contagious. Cold sores are tiny, painful, fluid-filled blisters. Type 1 of the herpes virus cold sores, or type 2 of the herpes simplex virus, affects the genital region, but SFV1 can also spread from the mouth to the genitals. Cold sores often appear in clusters on or around the lips. People may experience a tingling sensation in the affected area before a breakout. Number 3. Rosacea. Can't stop blushing? It could be rosacea, a chronic, long-lasting skin condition that affects roughly 14 million Americans, most often adults between the ages of 30 and 60, according to the National Institute. The skin condition usually hits men harder, though women are 3 to 4 times more likely to develop rosacea than men. Rosacea occurs when facial blood vessels become stimulated and dilate. Dr. Weinberg says, causing the skin to redden, blush, and flush easily. Other symptoms of rosacea include acne-like breakouts, red, thick, bumpy skin appearing on the face, and eye irritation and vision problems. While there seems to be a genetic component to rosacea, there are also some environmental factors that can trigger flare-ups, including the sun, hot weather, spicy foods, cigarette smoking, and alcohol. 4. Dry skin. Dry skin is the result of your skin losing a lot of water. A person may experience dry skin because of environmental factors, like low humidity or spending time exposed to high heat. You might notice flaky, rough skin or skin that cracks or itches. Some people have dry skin that's painful, stinging, burning, or peeling. Treatment options. Moisturizers are helpful for healing and hydrating your skin. You may also need to treat any underlying conditions like eczema or psoriasis that may be causing your dry skin. 5. Eczema. Eczema, also known as dermatitis, is a general term for multiple conditions that cause inflamed, irritated, and itchy skin. A common type of eczema, known as atopic dermatitis, is a chronic skin condition that affects 10 to 20% of children in developed countries around the world, according to research, appearing before age 5 for the majority % of those who have it. It may improve with age. Atopic eczema causes dry and itchy skin with raised, red, scaly patches and sometimes fluid-filled blisters. The issues typically appear on the hands or bending parts of the body, such as the inside of the elbows and back of the knees. Asthma, hay fever, and atopic eczema often occur together, partly because of certain immune-related genes. These all tend to be allergic manifestations and tend to all run in families with allergic tendencies. 6. Cellulitis. When bacteria infect skin layers and tissue below the skin, cellulitis is the likely diagnosis. Skin affected by cellulitis may be red, swollen, and tender and feel warm to the touch. However, it typically appears on one lower leg in adults and on the face or neck in children. The main treatment for cellulitis is an antibiotic, but people may need to take more than one in some cases. Other treatments include wound care, rest, and elevation for cellulitis on the leg. 7. Actinic keratosis. Actinic keratosis is a type of precancerous skin change related to sun exposure, according to the AAD. Weinberg says that actinic keratosis is one of the most common reasons people see a dermatologist. Actinic keratosis lesions are flat, scaly, and sometimes rough, and appear on places frequently exposed to the sun, and especially in the head and neck, including the face, lips, ears, and scalp. 8. Jock itch. Jock itch is in the same family as ringworm and athlete's foot, known as tinea. It presents as red, flaky skin that generally appears in moist areas of the body, like the groin, inner thighs, and buttocks. This is usually more common in adults than kids, which occurs when there is moisture in a warm fold of skin, for example, between the inner thighs and the scrotum, Davis says. Your risk for this itch-causing condition increases with prolonged exposure to warm, moist environments. Experts recommend removing wet clothes and trying to keep these skin areas as dry as possible. 9. Tinea versicolor. People with oily skin, like teenagers or those who live in tropical locations, are a bit more prone to tinea versicolor. Symptoms of tinea versicolor appear as scattered patches of discolored skin with varying appearance in different skin tones. On the back, neck, chest, shoulders, armpits, and upper arms, itchiness is also common, especially when sweating or with increased temperatures. Pregnant women often develop tinea versicolor, while those with compromised immune systems or people who take corticosteroids, have had an organ transplant, or diabetes are more susceptible to developing the condition. 10. Hives. Hives, also called urticaria, are itchy, raised welts that can be red or skin-colored. About 20 of people experience hives at some point in their lives. Many cases occur due to an allergic reaction. Possible triggers include foods, insect bites, latex exposure, pet dander, medications, and viral infections. Treatment options. Treatment options. Hives are usually temporary, but some people can develop chronic hives. Healthcare providers often recommend antihistamines to block or reduce the body's allergic response and ease itching. In severe or chronic cases, a healthcare provider may temporarily prescribe corticosteroids to address the inflammation and bring relief. 11. Pityriasis rubra pilaris. Pityriasis rubra pilaris is a group of skin conditions that result in red, scaly patches of skin everywhere on the body or in certain areas, most commonly the elbows, knees, ankles, hands, and feet. The causes are unknown, though it does seem to be related to certain genetic components and environmental factors. Pityriasis rubra pilaris looks like psoriasis, but is very rare. Thickened skin on the hands or feet is a common symptom, notes Gard. It's annoying, and it can be chronic and difficult to treat, says Weinberg. Most people will need oral retinoids like isotretinoin or acitretin soriatane, or drugs such as methotrexate if the retinoid treatment doesn't work. 12. Shingles chickenpox. A painful rash with blisters is a hallmark sign of shingles. 32. A shingles rash wraps like a band across one side of the face or body. The virus that causes chickenpox, varicella zoster, virus virus, lays dormant in your nerve cells and later reactivates to cause shingles. In other words, shingles only affect people who have previously had chickenpox. The first signs of shingles include skin sensitivity, itching, tingling, or pain. Days later, a rash of tiny, fluid-filled blisters. Shingles isn't passed from person to person. People with shingles can give chickenpox to others, usually children, if they've never had the illness. Treatment options. Healthcare providers usually prescribe antiviral medicines to treat shingles. Those medicines are most effective when started as soon as a rash develops. And finally, number 13. Acne occurs when oil and dead skin cells clog the pores. Pimples under the skin's surface that erupt with a white center are called whiteheads. Pimples exposed to air are called blackheads and look black. Other skin blemishes may form, including cysts, nodules, pink bumps, red, pus-filled pimples. Acne usually appears on the face, back, neck, chest, and shoulders. Bacteria Cutibacterium acnes and inflammation can play a role in determining when pimples crop up, as can changes in hormones. Some hormones trigger excess oil production, resulting in clogged pores. Adolescents are more prone to getting acne than others. For more exclusive videos, click subscribe and push the notifications bell. Thank you, guys, for watching, and see you again on our next episode.